It wasn't that you
Um,
had a lot of jobs maybe overall, but it was like at the same time you had like your main job and then you're doing your tutoring. And then I remember you saying at the you just worked at the store just to get discounts on the stuff at the store,
yes,
which I
I
was
did.
wondering if you work at a doctor's office or medical facility, did they give you any kind of discounts? I know you said you mentioned that the place that you were working at was very kind of exclusive as far as
Um,
being expensive.
I I don't know if I'm allowed to say. I mean, I
Okay.
feel like I can because
Okay.
like the practice is no longer together and the physician I saw no longer works
Right.
there. But I mean, I think one time I had like there was something wrong and I like lost my appetite and my stomach. I was in like so much pain. And he like gave me a free checkup, sent me to get some labs done. And then came back later and told me that I was fine. And that I should probably stay away from fried foods because my gallbladder is like a little eh. Um, so I mean, yeah, that's one thing that I mean, there are multiple incidences as well, but I mean, if you work there and you ask them questions, they'll answer you,
Hmm.
including about yourself. So they take it very seriously. It's like whenever I would ask the physician there, like, oh, something's going on, I felt like a patient, just like not in the patient room.
Right. Yeah,
Yeah.
you get, I mean, especially you're there and you get to listen and learn and, oh, maybe that's what's happening to me. It's all about the perks. It's all about the perks.
It is.
um, well, there's a lot of things I want to talk about. You also mentioned that, you noticed a lot of inequalities in the medical system, which I think despite the United States being a wealthy country in theory, you do see a lot of that, not just in the medical industry, but in everything. Um, so I don't know if you wanted to comment a little bit more about that. I know you said that because the treatment was so expensive, it kind of just excluded a lot of people from even considering going to see a doctor that they would otherwise consider doing.
Right. Especially for gastroenterologists, it's a specialized field. So most of the patients that we saw there were over the age of 50, and they're mostly there to get a colonoscopy and stuff like that.
Hmm.
But the inequality would exist would be for African Americans, where we are more likely to get colon cancer and stuff like that, but insurance doesn't cover it up until about the age of 50.
Mm.
So even if we are younger, it's money. Like it's a lot of money because not only are you paying for the doctor's time, but the nurse anesthetist, you're paying for the anesthesia. You're it's just a whole package of things, and if you can't afford to do it, then you just kind of forego it. And I think probably the most recent example would be like Chadwick Boseman. He wasn't even 50 years old, but yet he had colon cancer.
Right.
So, had he not been in his position of where he was, getting that treatment is not cheap. And
Yeah.
even getting screened is not cheap either. So,
Hmm.
there's a lot of medical inequalities, but that was just one that I saw when I worked there, and I was like, "Ooh, I don't like that."
Right.
It doesn't make me feel like everyone's being serviced to the highest level that they can be.
Yeah, and I remember I was telling my mom the other day when I was in Spain and I cut my hand and I just walked into a medical facility and I walked out, half an hour later, didn't charge me anything. Thanks, Spanish tax dollars. So um, you also talked about, I know we're jumping around a little bit. You also talked about having done a job that you didn't really like, which I think is an important thing for everyone in any position. Is it's happened to me too, where you do something, oh, I think I'd like this, and then you do it and you say never again. So I think it's you learn by doing, and you learn even if you don't enjoy the job, at least you're learning in the future. Hey, I don't want to work at Starbucks in the future.
Right.
So you mentioned this already, but you recently got your master's, so congratulations on that.
Thank you.
Can you tell us a little bit about what you studied and your research? Did you have a master's thesis? I know different masters require that, different ones don't.
Mhm.
What was your research about?
So my master's degree is in public health,
Hmm.
and public health has many different disciplines. I decided to focus on epidemiology and maternal and child care health. Epidemiology, study of diseases and how they affect the population. I mean, I feel like today there's no greater way to exemplify that than what's going on globally. So I really liked that, and it kind of goes back to like the seventh grade thing because of the salmonella, like hunting disease. It just sounded so much fun. It's like, oh, you're essentially like, doing surveillance, looking for diseases in the populations that they're happening in, and then trying to solve that to make sure that they don't happen again, or maybe they don't happen within the next generation. So I really like that. And I also liked the data aspect of it. I was never a huge fan of statistics, but it was something that I was good at. So it came along naturally. My dad was a statistician, so this is something that I heard quite often. Um, yeah, so I did epidemiology, and then maternal and child care health came along a little later when I found out about the inequities within birthing for Black women, any women of color. And yeah, I was like, okay, this is a problem. And I feel that with the education that I've received, and with more experience in the field and with more education later on, I feel like that I can help solve those issues as well. Um, I did not have a master's thesis. I had a master's practicum.
Hmm.
So I did my practicum at Nemours Children's Health, and it was for 6 months. I mentored a couple of students that were finishing up undergrad, and it was a public health with an epi focus, so an epidemiology focused, including health disparities. So my projects looked at pediatric lymphoma and gastric cancer and diet. So that gastric cancer and diet one looked at incidences of gastric cancer, the prevalence of gastric cancer globally, excluding the United States, and diet. So we're looking specifically at barbecued foods and processed foods, which because of the chemical components that are happening there, the reactions that are taking place can increase the risk of gastric cancer. We found that that was true um, across the board. And so just, being mindful of how often you eat barbecued foods and how often you eat processed foods, especially processed meats. They have a lot of nitrates and nitrites in them to preserve them, but those are not necessarily good for you in the long term. And then the pediatric lymphoma, that one was a collab, was mostly with my mentee. He did an awesome job. His name is Malik. He lives in Philly. He did a really good job with that project, especially because we were in a pandemic. We only had 10 weeks. Getting access to the data was really stressful. And that one is focusing on race and pediatric lymphoma. So looking at white, Black, others which were classified within American Indian, Alaskan Native, and Asian, and seeing how race, if race is a factor when it comes to the outcome and survivability. And it is. Um, Overall, including we also found that residents, so whether you lived in a metropolitan area or a rural area, also made a difference in terms of survival. Um, Soon to be published, I hope. But yeah, so that's what I did instead of a thesis, which I'm really happy I did that instead of a thesis because it introduced me to a whole lot of other topics and helped me sharpen my statistical skills, and because I had to help explain it to other people too.
Yeah, I was gonna say that sounds super interesting. Much nicer than just writing a paper. Although I don't want to limit a master's thesis to just writing a paper.
That's true.
Um, I'm a little disappointed that I was not invited to come eat the barbecued foods that were being studied. But it's okay.
No foods were actually eaten during the barbecue food study.
Well, then never mind. But you know, if you
You
do
missed.
another one and you need guinea pigs or guinea humans, let me know.
Oh, I feel like that would be unethical on my end, knowing the potential outcome.
Yeah,
But
but
if you insist, you know,
you know, I'll face the consequences.
you'll volunteer as tribute.
Well, yeah, temporarily for some ribs. Um, I remember you also saying that you know you were doing it was a school in Delaware or something, and it was all virtual because of the pandemic, right?
Yeah, that was that.
Yeah. So I'm sure that was a little frustrating that you couldn't actually be at the different place and be studying there, but it does sound like very interesting research and like a great opportunity to learn a lot.